Hello, and welcome to Prisma Health. You are here today because you have a loved one who is very sick in the hospital. Over the next several minutes, we are going to talk about what your visit will be like today with your special person and what you might see and hear while you are visiting. You can decide if you want to visit your loved one in the hospital. If you decide you are not ready to see your special person today, that is okay. They know you love them. You can let the adult who brought you know what you are comfortable with. Your loved one is in the ICU. That stands for Intensive Care Unit. This is where the sickest patients are being cared for by nurses and doctors who are always close by. Your person may look different. If you are worried about this, ask the adult who is bringing you to show you a picture of what your person looks like before you visit them. On the way to your loved one's room, you may see lots of things, such as healthcare workers, equipment in the hallway, other patients in their rooms. Before going into your loved one's room, you may be asked to wash your hands. It is important that we keep the ICU very clean to help care for all the patients. It is also important that we use our indoor voices while in the ICU. This is to help your loved one get the rest they need while in the hospital. Once you go into your loved one's room, you might see or hear things that you have questions about. Each thing you see has an important job to help your loved one while at the hospital. The first thing you may see in your loved one's room is their bed. This bed might look different than your bed at home. This is a special bed that is used only in the hospital. You might notice that the bed has wheels, buttons, and even moves on its own to help your person stay comfortable while lying down. You might also notice an IV machine next to your loved one's bed. The bag you will see is attached to a tiny plastic straw in your loved one's hand or arm that gives them medicine. Close by the bed is a TV screen called a monitor. It has different colored lights, numbers, and lines that tell the nurses and doctors your loved one's heart rate, blood pressure, and temperature. Lastly, you may notice a tube in your loved one's mouth or throat. This tube helps them breathe and is connected to a machine called a ventilator. These machines may make beeping noises and lights may blink while you are in the room. The noises and lights help communicate to the nurses and doctors. The beeps need to be loud enough so the nurses and doctors can hear them even when they are not inside the room. There may be other medical equipment connected to your loved one's body. You can ask your loved one's nurse if you are curious how that equipment is helping. It is okay to feel whatever feelings you are feeling. It is okay to be sad, mad, or even happy. It is okay if you need to cry. It is okay to stand or sit in the room where you feel most comfortable. Even if your person can't look at you or talk to you, you can still talk to them. You can tell your person a story or how much you love them. You can hold their hand and hang pictures or drawings on their wall. It is okay if you only want to stay for a short visit. Just tell the adult who is with you when you are ready to leave. We hope this helps you feel more comfortable about visiting your person. Remember, there are lots of people here who want to help you and your family. And if you have any questions, please ask.